and focus on the present, because that is really the only thing that you have any control over is right now. And so if you look around us, you and I and all the folks that are online here, do you have a roof over your head? Do you have a practice still? Do you have patients that need you right now and that will need you in 6 months? If you're just graduating from school, have you completed the 4 years? You have completed it. It's not over. You haven't lost it. So focus on the now, as opposed to letting the future kind of get away from you and steal that passion for productivity away.
How's it going, guys? Welcome back to another episode of the 2020 podcast, bringing clarity to business, entrepreneurship, and life. Thank you again for taking the time out of your day to join me here to learn and to grow. I have another amazing episode here for you today. Today's episode is an IG Live conversation that I had with Dr. Richard Maharaj, who is also known as the Dry Eye Jedi. He definitely is a guru and a master in the dry eye space. And we talk a lot about that, how he went from being a new graduate to opening a clinic that was specifically medically based on and specifically on dry eye, and how he created that space for himself and really was a pioneer in that capacity. But we go well beyond that because Dr. Maharaj shares some pretty amazing insights into psychology around being a professional, in particular optometrists, and how that's applicable right now in this COVID outbreak as we're all mostly sitting at home, and this desire for us to be productive and this need to be productive is causing anxiety. So we spend quite a bit of time chatting about that, and he shares some pretty amazing insights, which I personally found very valuable. In fact, I had a bit of a mini epiphany. Dr. Maharaj and I actually ended up having to record this IG Live twice due to some technical glitches the first time around, but he asked me some questions in the first one. Then I had some time to think about them again, and I answered very differently the second time round, as I was trying to be as transparent and honest as I could. And it was interesting to see the thoughts that I had when I had a little bit of time to think about his question. So I think everybody who listens to this will find quite a lot of value out of his insights around that psychology, anxiety, productivity curve. And as always, if you do find some value out of this episode, I hope you will share it with your friends and your family and your colleagues. And of course, take a screenshot, put it up on your Instagram story, tag us both, let us know what you liked, what you took away from it. Again, this is the IG Live conversation that I had with Dr. Richard Maharaj around dry eye and the psychology around productivity and anxiety that many of us are dealing with these days. I hope you love it. I look forward to seeing you guys again very soon. I'll talk to you later. Take care. One thing that I know I have said to you already, but I want to say again is I'm new to the dry eye space in general. Relatively, I've been kind of like dabbling for like the last 12 to 18 months. But shortly after I kind of got into it and I started to kind of really get into the deeper end and started talking with other people who are consulting in the space or doing it more, your name came up so much. And I was like, man, who is this guy everybody's talking about? And then like not long after, I had the chance to chat with you over the phone, and now here we are on video. So I appreciate you doing this, man, because for anybody who's not familiar in optometry, particularly in the dry eye space, Dr. Maharaj is a big, big, big name. So I'm truly grateful for you to be here, man. I appreciate that.
Oh, no, thank you very much for having me. I don't know about being a big name, but I appreciate what you're doing here, and looking forward to this conversation, even though we've had it before. But no, it's an interesting time for sure, for all of us, for various reasons. And dry eye, sure. It's not new, but it seems to have caught fire. So
for sure. Well, what I wanted to start with actually was, how do you become the guy? You know what I mean? Like, you're the guy that the people reference all the time when it comes to dry eye. Now, can you tell me a little bit about what that path was, and how you, maybe some little decisions that you made or big decisions that you made along the way that brought you to that level versus being like somebody who's just doing some dry eye in their office?
Sure. Yeah. Well, Rome wasn't built in a day, right? So it's a great question. And I wish I can say that I had foresight that this was my plan, right? My evil plan.
Well, I want to see what Karmveer
well,
said here. The way of the Jedi. I want to know the path to becoming a Jedi.
That's right.
That was maybe the right question.
That's actually probably more accurate, right?
Yeah.
So, I graduated in 2003. I don't know if anybody here knows that. So that's a long time ago. And it wasn't always my vision to enter the dry eye space. I've always had it. I've suffered with dry eye for many years, even when I was an undergrad. Even as a child, I had dry eye. And so I would actually do this. You might catch me doing this while we're on live. See how I have that blepharospasm. And so that at a very early age was misdiagnosed as me having a tic. And so at one point they thought I had Tourette's, and I went through that whole process. Anyways, it wasn't until I was well into practice, right? I went through optometry school, well into practice. And then, about 3 or 4 years after starting practice, I started looking at it closer. I stumbled across the tear science technology. And I at the same time I was doing my fellowship. And it kind of all happened around the same time. So I focused my fellowship on the ocular surface and became fascinated by it. And it started to reflect a little bit of what I was going through. And I just went deeper and deeper. It was around that same time that I was completing my fellowship that I decided to change gears a little bit from a traditional optometry practice that I was a partner in to a more disease-focused practice, which is eye labs. And the disease that I was focusing on specifically was dry eye. I had other colleagues that came on board, like Dr. Faran Vafai, who's into glaucoma, Karmveer Kamra, who's on our team now, who's just been dubbed the retina guy.
All right, nice.
So, but we just kind of brought people together. But for me specifically, focusing on dry eye since 2012, which is when we opened, I think that evolution of beginning to see cases early on and developing a referral-based practice, you eventually, get I don't know if you've heard the saying, you need 20,000 hours of practice to become an expert at it. Well, I got those 20,000 hours pretty early on, and next thing you knew it, I was getting complex cases being referred from both ophthalmology and optometry and medicine and doing more consulting work and at the same time, teaching. Right, teaching is a very it's a passion of mine, perhaps because my parents are teachers. So I think teaching made me the best learner, and I think learning made me the best teacher. And I think it was all cyclical. But to answer your first question, it wasn't really something that I had planned. Jedis, we kind of just get pulled into the force. We don't guide the force.
Fair enough. I love that. Anybody who's not a Star Wars fan is probably going to be rolling their eyes, but I'm feeling that vibe there. Before we go on to the next question, thank you everybody who has joined in on the call already. I'm talking to Dr. Richard Maharaj, who is an expert, if not a guru, but definitely a Jedi in the dry eye space. And we're going to be talking about dry eye for sure. We're going to be talking about a little bit of how to become, if you're an optometrist, how you might want to get into that space, what the future of optometry is, but then also we're going to be talking about the psychology around productivity, success, optometry, and then, how that applies to what we're doing right now here sitting at home. So stay tuned as we go through those different topics. But if you have any questions, we also really would love to engage. So if you have any questions, there's a little question mark box at the bottom. Just click that and type your question in there. And then that way I'll see it. It'll stay there instead of going to kind of scroll through the feed and I might miss it. Feel free to throw out some comments along the way if there's something that you find particularly interesting as well. So you've told us, Dr. Maharaj, your path to becoming a Jedi. Now, what about us young Padawans who want to kind of get some more experience and kind of at least start to dabble in the dry eye space? What kind of recommendations would you have for somebody who's starting from scratch, maybe has no particular experience or specialty right now?
Yeah, that's a great question. And I love that you asked it. And I think that, you're perhaps a few stages away from just getting started. I think you're well-versed from what I've heard, so kudos to you. But I think in general, I think anybody that's practicing in eye care right now, whether they like it or not, they're seeing dry eye. Whether they're treating it to the degree that the evidence suggests is probably debatable. So the question I always get is, so how do I get started? What should I buy first? How do I tell patients that I'm doing this? And so I think the first thing that most people should do is actually advice I think that's good for life, which is to name it. Okay. And so I think whenever you name something, whether it's a feeling that you have inside of you or whether it's a disease that you're trying to treat, when you label it to a patient, it starts to become real. So how do we label dry eye in our practices? Well, the way that we label it is by asking the right questions. And so, you and I both know this. One of the key ingredients into diagnosing dry eye disease is having a validated symptom measure. So using the questionnaire of your choice. Now, I use both DEQ5 and the SPEED questionnaire. We talked about SPEED the other day, and I know you use a DEQ5. These are very quick intake questionnaires that take less than a few minutes for a patient to fill out, but that will give you a very, very good sense of the patient's proclivity to having dry eye disease. And so if you were to decide that you wanted to really jump into this, the first thing you do is for the first 1 month, give every one of your patients a questionnaire, a SPEED questionnaire or a DEQ5, and that will give you a litmus test of the prevalence in your practice, at least a very rough number. I'd say a good number, but a rough number of how many patients are there. And then from that, you can start to plan out, okay, well, maybe I have actually 50 patients a month that I didn't realize had a SPEED score of 6 or greater that need a little bit more help. Now I have a little bit more confidence in doing that. At the same time, when you start to use those questionnaires, you're also labeling it to the patient. The patient's probably going to wonder, what's this questionnaire about? Gives you an opportunity to do what? To answer their question that they didn't even know they had. So you start to uncover this problem. And the minute you call it something, the patient will latch onto it, and there begins the path to education. So then it becomes an educational directive, as opposed to trying to look for it and treat it. And I think we mentioned this as well. Once you have the questionnaire done, I'm assuming that every OD in the room has a slit lamp and hopefully has some fluorescein as well.
Yeah.
Well, then you've got your other tools. So you don't have to go and invest, go knee deep into debt, especially not now, into mybography and various point of care testing. You have the tools you need. As long as you start with a questionnaire, you're getting a lot right off the bat.
Yeah. Absolutely. And I think I really appreciate you stating that out loud, because I have to tell you my own personal experience, and I know this applies to a lot of other people in this particular position, is you're sitting at the front and you're like at the beginning, like at the start line, and you're like, oh, this is going to be too expensive for me to get all the way to that finish line, or what is a perceived finish line anyway. I got to get a mybographer. I got to get this thing. I got to check the, all these other things, and I got to buy the LipiFlow and all these other things to treat. But that's not how you start. That's how you progress slowly. The DEQ5 has been super helpful for us. And like, we talked about, we give it to every single patient that walks in the door, whether they're new or existing. And it's pretty cool for us, for myself as the doctor, for the staff, and then of course for the patient to see how many people actually have symptoms of dry eye. And then, the slit lamp, tear breakup, and a little bit of, compression of the eyelids, and all of a sudden you have enough information that you need to start diagnosing it. And I think the education portion is so important. And like Karmveer said here, inform, develop a plan, and see what you can do for them. And I found that the informing and explaining the plan of action to the patient has been super powerful for us. And, and that's before we start doing any kind of specialty, fancy type of treatments or diagnostic stuff. So, so for anybody out there who is looking at it, just think about how simple that really is. It truly is that simple. We're not just saying that to like somehow dupe you into getting started in dry eye. You
know what? Before you continue, I think you've hit the nail on the head there. It is simple. The reason that people don't jump into it, I don't think it's because of its simplicity or the perception that it's simple. I think the reason that we don't jump into it is the same reason that I'm perhaps not jumping into VT or surgery right now. It's not something that we can do, but I think there's another mental block, I think, that prevents us from jumping into new, depending on where you are in your career. And so I think we have to kind of decouple those things. What's the anxiety that's preventing you from doing something new, whether it's buying a practice, whether it's buying a house, or putting a ring on that finger? What's the mental block there? And if the process to getting there is actually simple, then that's great, because once you get past that mental block, it's just going to be liftoff.
Yeah, fantastic. And that is tough. And that mental block, I'll just, from my personal experience, what I've found that helps is just to keep talking to people who are doing stuff that I want to be able to do. So for example, yourself or Trevor Miranda or whoever else around here who's done it, and kind of understand what the process was and what you guys have done in the past, not what you're doing now, because that will stress me out, but what you did in the beginning. And that always helps to then kind of set a plan in your mind.
Yeah, absolutely.
I want to just take another second again to say thank you, everybody who's here on the call. I appreciate you taking the time to join us. I'm talking to Dr. Richard Maharaj, dry eye specialist, but we're going to be talking about a few other things related to the psychology around optometry and success and productivity as well in just a few minutes. If you have any questions, use a little question mark box at the bottom, drop it in there. The next thing I wanted to ask you, Dr. Maharaj, was the Canadian Dry Eye Summit is a fairly new conference, but from my perspective, in a very short period of time, has become something that is really well known, and a lot of people are excited for and looking forward to attending every time there is one. There was supposed to be one in Vancouver next month, but of course, circumstances won't allow it. But I'd love for you to tell us about where that started and what the sort of the mission is of the summit.
Yeah, so that is true. We are no longer having the Vancouver meeting as a result of our current state of pandemic preparedness. But so the genesis, if you will, of the summit really started prior to the summit. Actually, in 2017, I held a small meeting in Toronto, just outside of Toronto, with so I was the editor-in-chief for the CRO journal back at that time. So we held a small meeting of about 50 ODs, and focused on dry eye. We had a one-day session. It was great. It was a wonderful thing. And I think shortly after that, Dr. Jeff Goodhue had attended that first meeting, and so him and I got to talking, and him and Dr. Miranda, Trevor, you just mentioned, had been working on a network called mydryeye.ca, which was meant to be a sort of a patient-facing education site that also tied patients to their dry eye doctors. And so that was sort of a concept that they both came up with, and we all got to talking and said, hey, look, I think we can put something together here where we tie education to this patient portal to doctors. You know, that's like the trifecta. So I took on the position of the chief education officer for mydryeye.ca, and we basically started the Canadian Dry Eye Summit the year after. So 2018 was our first summit, and we did that just outside of Toronto as well. And we sold out in about a month, a little less than a month, in fact. And so we're all kind of stunned by that. Maybe we shouldn't have been, but the capacity for learning was huge. So we just kept on going on. We stepped up our game for our 2019 conference, which was actually just this past November. I had to think about that, where we increased our attendees. We also added a assistance track, what we call our ocular hygienists learning, which was a learning day for assistants, where they got hands-on experience with, microblepharoexfoliation, iLux, LipiFlow, IPL, so they knew how to assist their doctors. While on the doctor's side, we had sort of we called it Summit because it was very much like climbing a mountain. Right, you have your base camp where you get your basic knowledge, your basic dry eye science. Then we added on with some more complex immunopathophysiology. We had Dr. Laura Perriman talk to us at length about that. I'm a big fan of hers. And then we also built in a hands-on component for the docs. So you would actually get, there's a 2-hour, almost like a bell ringer style pit stop where you'd get to touch and feel and try the equipment. Not a trade show, but specifically a hands-on live with the equipment. So you got to see and feel what it was. And so that went on for 2 hours. And then we capped off on the Sunday with a practice management piece. So again, going back to what we talked about earlier is, the implementation isn't always the clinical piece. How do we tie that into practice? And so Dr. Trevor Miranda, in fact, this year, and Dr. Henry Reese gave a fantastic talk too about integration and how to build it into your practice. So we really wanted it to be a soup to nuts type of conversation, and The feedback has been phenomenal. We had it was a very palpable group. You know, you tend to circle around like minds. When you get like minds in a room, wonderful things happen.
Yeah.
So that was going to lift off into 2020, the year of the optometrist, and things kind of, I guess, life didn't mean for this to happen. So we're now planning for our Toronto meeting, or our original Toronto meeting, which is going to be November of 2020. This is an exclusive to 2020 podcast. We're going to be having a virtual conference, a virtual meeting in November. So you heard it here first, folks.
You heard it here first on the 2020 podcast. The Dry Eye Summit, Canadian Dry Eye Summit, will be virtual this fall. Very cool. So with that, I mean, obviously, when you have a conference in person in a physical location, you're limited by space and the number of seats and everything else. So doing virtual, does that mean this is going to be open to a lot more people? Is that kind of the goal? I know you guys are still, and some of this is hush hush, but if you can share that a little bit, and who would that be open to? Is there certain limit there?
Yeah.
Or?
So yeah, no, great. We're definitely not limited by space anymore. So our capacity will certainly increase. It is hush hush. We're still kind of working out the details. We want to make sure that, as we've done in the past, is we've always tried to be ahead of the curve, changing the game with our mode of education, how we deliver it, our dynamic means of having an educational meeting. So when we're now starting to look at doing this virtually, we want to make sure that we're continuing to innovate, that we're not just going to put on a live meeting online. We wanted this to be an immersive experience as much as possible, even though people are going to be attending from afar. Yeah. And we've done that by polling our previous attendees. In fact, we asked them, what do you want? Do you want a live meeting, or do you want a virtual meeting, or do you want a mix of both? And we listened. And the overwhelming response we got was, yeah, let's do this virtually. People are still, wanting to be safe, and we don't know what the world's going to look like 6 months from now. So we thought virtually is the best way to go.
Yeah, for sure. And we'll probably talk about this a little bit more, but now that we are forced to do things virtually, I think a lot of people are kind of realizing there's some benefits to it, whatever those might be. And, it probably is going to behoove us to try to incorporate this in all facets of what we do now, whether it's attending a conference or whether it's doing telemedicine. People are going to start to get used to this to some degree and might even prefer it in some cases. So, it's a great, I think it's, on the bright side, the silver lining is it's forcing us to become a bit more innovative, and next year we'll have the ability to do a combination of both, and it'll just be better for everybody, right?
Absolutely.
So that's excellent. And if somebody wants to inquire more about the summit, where would they go for that?
Yeah, so right now we have a live site at dryeyesummit.ca. For those interested in joining the My Dry Eye network, so mydryeye.ca is an avenue to get involved with that. So if you're a member of mydryeye.ca, then you automatically get information about the summit and some of the other initiatives that we're doing while we're in this closure state. If you're a My Dry Eye member, we're doing a Ask Me Anything on Tuesday night, where you get to ask me everything. So there's a question I see here. A lot of innovative product which can give systematical improvement in your stability of the tear film. Tell me your advice. These are the kind of questions that we'll answer on Tuesday night, but that would probably take a little too long to answer on this call.
Yes. Thank you for addressing that. So I appreciate the question, guys, but we won't be addressing any specific health-related treatment type of questions here. This call is more so to learn more about what Dr. Maharaj is doing and his take on the profession. But please tune in to his webinar. When is it? Sorry, Tuesday?
It's on Tuesday night at 8 Eastern. So if you sign up at mydryeye.ca, you'll get some information there.
Okay, got it. And then you'll be able to ask him anything. For example, how did you become a Jedi? What color is your lightsaber? Stuff like that. So, obviously, as I kind of alluded to, our profession is going to change, I think, quite dramatically due to this outbreak, and now we're doing a lot of this stuff, virtually. Do you have any thoughts on where we're going to be, the profession as a whole, 10 years from now, 5 years from now, just some point after this?
Yeah, I've been told that I'm a prognosticator because I opened a dry eye clinic, in 2012 when it wasn't sexy yet. I think I might have made it a little bit sexy. I don't know, but
you had something to do with it, that's for sure.
I had something. But yeah, that's a great question. I think how we evolve from here is going to unfold. It's going to unravel very slowly over time. But I think we're already seeing some signs of it, right? So the adaptation to providing remote services through telemedicine, I guess phone consults if you're using phone consults, but remote care I think is going to become more and more a part of our practice if it isn't already so, right? So a lot of us have adapted. I think you talked about it the other time. We're using Doxy. We're using Doxy.me as well. And I think the integration of our teleplatforms with our EMR, I think we're going to see more companies kind of building those two things together, stitching those solutions together to make it more seamless for both the practitioner as well as for the patient experience. But I think one step further than that is also tying, health disciplines together virtually. So optometry and ophthalmology, we work very closely together in the community setting. But, you and I probably can both attest to this. Sometimes you refer a patient, you don't hear back from the ophtho until the surgery's been done. And, there's a lot of missing pieces. And so I think tying the different disciplines together virtually through telecollaboration, I think that's going to increase too, which will again make the patient experience that much better. Some other things that might I think come across, and again, not to be controversial, but I think how we define routine care, routine eye care, I think that's already kind of starting to change. We look at the various provinces and guest states. If you have U.S. Viewers, you've had various states of emergency called, and the reduction of services to be essential and urgent. And that definition of essential and urgent, I think, is calling some of us to take question as to what is essential and what does it mean? What does routine care mean? So in the weeks and months that we start to go back to our offices and we start to pick up the slack from the last 3 months of, let's just say 3 months of closure, your practice is going to be full of disease patients, medical patients, those that truly need that care. And I think it may cause, it has for me, we have a disease-focused, referral-based practice. So I think the focus on medical practice, medical optometry, I think that will start to rise. In addition to that, I think the further stratification of optometry into our specialties, right, into dry ocular surface, and glaucoma, low vision, vision therapy. I think these areas that we're stratifying, I think those will continue to stratify. I think we're going to see more and more specialization and truly specialization, not just, having a special interest in. I know that there's work being done in Alberta, and I'm secretly a part of that too, but I won't say much more about the development of specializations in optometry. So I think those are some of the things that will emerge. 5 years from now, I hope that we're in a better place. We're providing better care. I hope we don't get sidetracked with what we've lost, and I could hope that we're providing better care and better services for our patients.
Yeah, for sure. I think so. What's interesting is I just started recently. I've only done one of them so far, but I started a little webinar series, which I know I'm going to talk to you a bit more about in the future, but where I bring on a group of ODs and talk about some of these topics. And one comment that Dr. Adam Ramsey made, which I thought was so perfect, was, the virtual thing, and you were talking about specializing, but the experience that you offer your patient in the office has to be so good that they're going to want to put on pants that day, because now they know they can do a lot of this from home. But when you're specializing, when you're providing such a specialized level of care that they know they can't get that anywhere else, and they definitely can't get it virtually, they will want to come into your office. And I think that's really good advice for somebody who's wondering, like, is it really still worth starting a dry eye practice? Dr. Maharaj started a non-retail specialty practice in 2012. Was that right?
2012.
Right. When
in Ontario,
yeah. So, which seems like the craziest idea at that time. I'm sure it seemed like a crazy idea. Still seems like a kind of an intimidating idea, but clearly is. There's opportunity there, as opportunity both to serve people and to be financially to benefit from it as well. So, take his advice there. If you guys are considering specializing in something, it's not too late. It's not the wrong time. It's actually probably the right time to take stock of the situation and take some time now to develop a plan to do it. My man, Dr. Daryl Glover here had a question. I want to see if you have a take on this. How do you incorporate social media into marketing a dry eye practice? Have you guys been using a lot of social media, or are there certain avenues online in general that you've been using?
Good question. You know what? I would probably push this right back to you, but when it comes to being social media savvy, I think I've done as good a job as I can. A lot of our momentum was built up organically at the beginning. So back in 2012, what I did was I just started blogging. I had a lot of time on my hands, and I would write every day, share it out to the masses, and just put it out there. I think the equivalent of doing an IG live every day. Back then, we had to write it out, right?
Yeah, absolutely.
We have our presence a very small presence, mind you, and on Instagram and Facebook. We're a little bit more popular, just given my demographic. Yeah. And Twitter as well. Yeah, I'm telling you, man, that's how it goes.
You're aging yourself, but okay.
I'm happy to do it, man. I'm proud. I'm proud.
If you want to be hip, you just gotta say, "Yo, we're doing everything on TikTok now. We're promoting TikTok. Our dry eye practice on TikTok somehow."
Our clerkship student Diana, she's starting a TikTok page for our grand rounds thing that we do on Fridays. So
nice.
I'm hearing cool. TikTok is the rave.
That's awesome. You know what? It is the thing. I always knock on it, but I do it as a joke because it's there and it has some value, but you have to do it the right way. So if you have a student who is creating the content and putting it out there, then I think that's a little different than if you're trying to look, you're a doctor who's trying to look professional. And you still could do it. I'm still evaluating exactly how that might work.
There's not enough time in the day, man. I honestly wish I could, but short on time.
Please don't do TikTok.
All right, I'll leave that to you, Dan. I'll leave that to you.
Thank you. I just want to say a quick shout out to everybody who's joining the call. Thank you, guys. Some really great people on the call here, including my wife. Thank you very much for joining. We got Solomon here, Dr. Sayan for Prime Minister. I think I think Dr. Maharaj might be ahead of me in line there, but maybe we'll just start a campaign together. A dry eye party or something like that. Again, thank you guys for joining so far. We're going to step into a slightly different realm here. But if you have any questions, there's a little question mark box on the bottom of the screen. Just click that and type your question in there, and we will be happy to address it. In fact, there is one here. Let me just see if we can. Solomon asks, do you utilize telemedicine for dry eye follow-ups? Have you in the past? Do you plan to going forward?
I haven't in the past. I've done everything live, but obviously now is a different time. So yeah, we are doing teleconsults at this point. I knew right away, as soon as we decided to close our doors, Diana's online, she'll tell you, I already knew the first 10 patients that were going to reach out to us for teleconsults. And those are the ones that are highly anxious, that have neuropathic pain and corneal neuralgia. So providing teleremote services for them was more of a hand-holding opportunity than anything else. We can instill fluorescein from a distance, not yet at least. We can't do much, but a photo goes a long way. And history, I think part of our learning during quarantine grand rounds that we did on Friday, we learned that a good history will give you 9/10 of the information you need. So we really spent a lot of time on getting a thorough history, and it's been very helpful, especially those patients that are high needs right now. They're a lot of people are losing their way right now, so we want to make sure we're holding on to them and holding close.
For sure, 100%. Thank you, Ryan. I appreciate that, man.
That's a good question.
Well, actually, I'm thanking Ryan for saying I'm on fire. I appreciate it. But Saul, that was a good question. And you know what? I think Karmveer maybe said it earlier. I think telemedicine is going to have a really important role for I think what you just said, the hand holding. I do a lot of hand holding, and my business partner and my staff give me heck for it, because I have a lot of people coming in who are like, just want to talk to Dr. Sayan for a minute, and it makes it hard because that's chair time, right? So the telemedicine is going to help there a lot. It's going to help take a lot of those quick follow-ups off the schedule, and open up time for more important things or things that will take up more time.
Yeah, I mean, ultimately, it optimizes your capacity, right?
Yeah,
So it will end up freeing up some chair time when we do eventually go back live. And
yeah.
Diana correctly says here, we've been reassuring patients and reducing their anxiety through these consults. Absolutely. And I tie in Diana as much as we can. She's our current clerkship student. She's finishing up this week. So soon to be Dr. Diana.
Great.
But yeah, it's a win for our patients and a win for us.
Awesome. Good job, good job, Diana. And I think you're very fortunate to be working with this man. Good. All right. Well, I wanted to switch gears earlier, and then I got sidetracked. But really want to talk about the discussion around productivity and how we tie productivity to success, and how that's causing some anxiety these days as we're all sitting at home trying to figure out what to do with ourselves. You had some really cool insights, really valuable insights. So I'd love for you if you can just introduce the topic to us and kind of what your background is on that, and we can go in a bit more depth.
Yeah, so I think over the last few weeks, I've been talking a lot to students. A few of them probably are online right now, Diana as well. And then colleagues alike. I have colleagues that just opened a practice or that are actually still building their practice, planning on opening the next little while. Colleagues that are midway through their career, and this is giving them pause. You know, they just had a couple kids and it's gotten them to think a little bit differently. And then colleagues that are at the end of their career that were planning on, you know, kind of cashing in their chips. Mm-hmm. And then what seems to be a common thread through all of this is this sort of generalized anxiety. And I've spent a lot of time, you know, my wife's a social worker, and we talk a lot at home about, you know, mental preparedness, right? We teach our kids how to really, you know, emotionally evolve. And, you know, starting, as you mentioned earlier, starting my practice 8 years ago in Brampton, Ontario, which wasn't a high spending population, in a non-dispensing practice. I had just, my daughter was 6 months old at the time. Wow. My wife was still on mat leave. I mean, if there was a worse time, I can't think of it to do something like that, but I did. And, you know, so dealing with stress and anxiety was something that the way that I controlled it was by learning as much about it as I could. So I read and I read and I read, and I really invested in self-care and my emotional health. So from that, you know, what I've found is that a lot of people that are going through what they're going through now are perhaps, you know, tying their productivity to their self-worth, right? So I asked this to you, and I'll ask this to the group. I'd love to hear everybody's answers. You know, how do you define success? What does success mean to you? Is it, you know, the money that's in the bank? Is it the roof over your head? Is it the Benz that you have? I know Carnveer wants to get that Benz real fast. Is it, you know, what is it? How do you define success? And I would argue that a lot of us, particularly us in optometry, will likely circle around productivity.
Yeah,
and
one sec. Sorry, Dr. Maharaj. Yeah. Actually, you did pose the question to the group. I would love to hear some answers or see some answers. If you guys want to share, if you can ask the question one more time.
Yeah. So how do you define your self-worth, right? So how do you define success? What does success mean to you in a very simple word?
But sorry, go on, and we'll see if some answers come in while you're talking.
So, you know, in light of that, when we define ourselves through our productivity, so you and I right now are doing this IG Live. Neither of us are getting paid for this. I've been doing a ton of webinars. I'm still waiting for my check to come in. You know, I'm doing a ton of webinars. We're doing the grand round sessions on Fridays. There's no money coming in yet. Somehow I'm drawn to being busy and the busyness of being busy. Mm-hmm. And that is, in my life, I've understood that is actually how I have tied success. It's not money. It's actually doing things as teaching. So the thing is, we're all going, and it's good. I see some people talking about happiness here, which is great. I think happiness is a great way to define your success. And this requires a lot of introspection. You know, a lot of people will give the right answer, but I think these are questions that are also good to think about over the next few days and weeks. What's really the answer? What drives you? What's your why? So going further, you know, when we suddenly become unproductive, if we've defined our success by productivity and we become unproductive, as we're forced to all have to do right now, when we can't spin lenses, when we can't put fluorescein into an eye, and we lose our our purpose, we go through a collective grief. And that's really what's happening right now, is we are going through a collective moment of grief. And it's not the grief that we're familiar with, right? We're familiar with acute grief. So death of a loved one, a horrible diagnosis of cancer. These are acute levels of grief that we've expected. But this pandemic has brought about something that's called anticipatory grief. And anticipatory grief is more ominous. It's less obvious. It's the feeling that something bad is coming, but we're not exactly sure what it is. We still have this sort of pseudo-normal world, this bizarro world, but there's this cloud that's constantly hanging over us. The thing is, regardless of the type of grief, we still go through the stages of grief. So you remember being taught in school the stages of grief, right? There's denial, right? Think about when COVID first broke, right? It actually broke in November, but we really started hearing about it in January. And what were the first kind of things you started to hear about? People saying, "Oh, this is nothing. It's not going to turn into anything."
Yeah.
So what does that sound like to the audience? It sounds like denial, right? Yeah. So we started off with denial, and then people started getting angry when they started to see more and more people wearing masks and wearing gloves when they didn't need to, and so they would get angry in public at anybody. And so that's anger that started to show up. Sadness started to swell. Depression is starting to increase. So our mental health, our capacity to manage ourselves and each other compassionately are starting to show the weaknesses. And so once you start to label it, as I said at the beginning of this, if you can name the anxiety, if you can name the grief, then you can take the power away from it. And once you start to raise your level of consciousness above that, it starts to get a little bit easier. And what I've said to you earlier is, if we can start to perhaps disconnect our productivity away from our own measure of our worth, then I think we can start to focus on what's happening now, being present. Mm-hmm. So one of the things I tell my daughter, I remember the first day of school, she was, a little nervous. So what I told her, we were sitting in her room, and I said, point out a few things in the room. So she pointed at her teddy bear, she pointed at her piano, she pointed at her little brother, right? All the things that were present around her. And focus on the present, because that is really the only thing that you have any control over, is the right now. And so if you look around us, you and I and all the folks that are online here, do you have a roof over your head? Do you have a practice still? Do you have patients that need you right now and that will need you in 6 months? If you're just graduating from school, have you completed the 4 years? You have completed it. It's not over. You haven't lost it. So focus on the now, as opposed to letting the future kind of get away from you and steal that passion for productivity away.
Yeah, that's incredible. I want to somehow address everything you said, but there's so much good stuff in there. There's two things I want to do. One is I want to read some of the comments that people made about success, and I want to make a confession to you in just a second here. Okay, so Solomon said success is working without working, as in realizing that you love what you do. Happiness is success. Harinder says success is doing what you love, similar to what Saul said there. Karmveer, definition of success has been changing as we go. I feel like the pandemic has put a lot of things in perspective. Sure has. Pam says happiness. Daryl says relationship with God and smiles on family's face. Saul, there's an article in Harvard Review. We'll have to check that out. Bruce, success is making sure that you are consistently improving yourself, supporting your family, and serving your community. Advanced Eye Care, gratitude does wonders. Sure does. Wow, I didn't realize I missed so many messages here. Thank you, everybody, for chipping in. I appreciate this. Echo Bruce's response. Absolutely. Everybody loves Bruce's response. So true. Perspective is everything. Gratitude for what you have, and crisis can really bring clarity on what's important. Yeah, amazing feedback, guys. Thank you for that. So my confession is, last time you asked me this question, I gave you one of those sort of generic, it was the first thing that came to mind. It was a truthful answer, but it wasn't as deep as I think maybe you were hoping for. Because I said I kind of use the rocking chair test. A lot of times when I'm wondering if I'm doing the right thing, or if what I'm doing is going to make me happy, I think about when I'm an old man, I'm sitting there, am I going to be happy about what I just did or what I spent my time doing? And I do that. But after that, I was talking to my wife about this, and She called me. She doesn't usually hesitate to call me out, which I appreciate. But I realized that as I was saying it too, is like, I actually am guilty 100% of what you're saying. You know, keeping busy to feel like I'm working towards, or I'm building my success, or I am successful right now because I'm doing some work, right?
Right.
And so in that last couple of days since we spoke, I've definitely had that kind of thought in my mind, and now going to approach the coming weeks a little bit differently because of it. So I appreciate that. And I wanted you to know
excellent.
that I've been definitely wanted. And I think it's so important that, like, if I have any kind of a platform that you know, even as small as it might be, and not that I have any kind of massive audience, but the people who do watch and listen, you know, I want to make sure I'm being truthful and transparent and practicing what I preach, right? So I don't want to be up here and be like, yeah, I'm living exactly the life I envision right now. No, definitely working through it.
You know what you've just done, and I'll give you an applaud there. What you've just done is something that you don't often see from the podium, right? You don't often see key opinion leaders changing their minds right in front of you, right? Normally they come with not a hidden agenda, but an agenda, a belief system that is probably based on some type of objective information. But to have an open mind and to be able to in real time change that or reflect on something in a different way, I think is why we're all kind of having a bit of a hard time right now when we see our leaders around us that are saying, you know, be steadfast and not changing their opinion. They're still singing the same tune. But I think the ability to be dynamic right now is what's very inspiring, and I love to see that in colleagues around me. So kudos to you for that.
Thank you. Well, thank you. I appreciate that, but I have to give you the credit for triggering that in me. So thank you very much. So really amazing insights again. There were a couple of questions here. I want to see if we can try to address real quick, because with an IG Live, we have a 1 hour limit. So we got 14 minutes before this thing cuts out on us. Let's go with this one here. If you plan to incorporate telemedicine in your regular practice in the future, would you be doing calls during regular office hours?
It's a great question. It would depend on a lot of things. I think I would try the best that I could to do them at a particular focused time. So I'd probably carve out a portion of my schedule to just do teleconsults. I'm a big believer in work time being work time and family time being family time. So I probably wouldn't try to do that as a late night type of thing. Mm-hmm. So I would likely carve out a moment of my day to kind of handle those. And the teleconsults don't take an awful long time. They can be 5-minute calls. So
I would probably just do them at lunch, to be honest. The 1 hour lunch that becomes a 20-minute lunch would then be my 20 minutes to do telemedicine while I eat at the same time. Daryl asked, earlier you mentioned working with OMDs, but what about rheumatologists, PCPs, endocrinologists, and others? I don't know if I can read. How do you connect with them? I'm not sure. I'd let you answer this, but I'm going to say I'm not sure how applicable that is for us here in Canada, but if you have any thoughts.
I mean, the way that it was sort of, an organic type of connection. So my clinic is very closely tied to ophthalmology, and our intake system is ties in a lot of different medical disciplines. So rheumatology. So for our Sjogren's patients, we just ended up attracting those. We became sort of recognized as leaders in ocular surface care. So rheumatology came to us, and so I guess we were fortunate. I can only say that we were fortunate enough that we were doing good work, and I think everybody that's doing good work eventually gets known for the good work that they do. So medicine tends to come to us. But you're correct in saying that, Harbir, and that in Canada, the collaborative models around different health disciplines is a bit different than it is in the States. So, for instance, in Ontario, I can't directly refer to a rheumatologist or a psychiatrist. I can only refer to ophthalmology. So the pathways are a bit different. Yeah.
But I like, as far as if you're talking about having people refer to you, then I think it would require a little bit of effort. I mean, you've established yourself as an expert in the area, so people will find you, but for somebody else, maybe reaching out to those people in different ways to let them know that you offer those services. We are limited on time, so I apologize if we didn't get to anybody's questions. There's 2 questions that I like to ask at the end of every podcast for every guest, and I'd like to ask you those questions before we wrap up. So number one Number one is if you could hop in a time machine, I don't have to come with you, but if you could hop in a time machine and go back to any point in your career or earlier where you were struggling with one thing or another, you can share that moment if you'd like, but more importantly, what advice would you give yourself at that time?
Yeah, this is a good one. I thought about it over the last few days, but I'm going to stick with my original answer because I want it to be organic. So
Sure.
I thought about I would go back to, my late high school. So OAC, I think is what it was known as. That was grade 13.
All right.
We had that in Ontario at that time. So that was my final year of high school. And I was, kind of talking about what I was talking about earlier. I was very tied to productivity. I was very busy. I was in the band. I love band. But I was, a valedictorian, and I was busy, and I enjoyed the different groups of friends that I had. But deep down inside, I really felt like I needed that quiet. If I could tell myself anything, I would tell myself to enjoy the quiet, to lean into the quiet, because that is actually who I am. I'm most comfortable when I'm quiet. I'm most comfortable when I'm kind of just sitting around at home with the kids, and I can sit silently with my wife, and it's not because we're fighting. It's actually just because we're silent. And sometimes enjoying the silence. I'm dating myself here by saying I'm a huge Depeche Mode fan, but
yeah, maybe a little bit.
Enjoying the silence is the advice that I'd give myself.
That's excellent advice, and I think more than ever, that's probably important advice. I mean, with all of our devices and everything that we have that are creating noise, that's really, really important. So thank you for sharing that. And the second question, the final question that I like to ask is everything that you've accomplished, all these different things that you've built, and you've been a trailblazer in many ways. How much of what you have accomplished would you say is due to luck, and how much is due to hard work?
Yeah, so I think, I'm a big fan of the Pareto distribution, the 80-20 rule, right? So I think most things in nature follow that path. 20% of the work ends up affecting 80% of the people, or vice versa. So I'd say 80% of it is hard work. 20% is you call it luck, and I perhaps will refine that definition a little bit. I think luck is perhaps not the correct word. We are a product. All of us are a product of the world and circumstances that preceded us. You and I didn't get to choose our mother and father. I didn't get to choose where I was born. I had no choice in that. So, I have a hard time saying, yeah, it's free will that brought me here. I think there is a certain amount of even the decisions that we make in the moment. You're choosing to love someone, you think that's a choice, but some of that is biologically driven, right? So how much of it is a product of our previous context, and how much of it is just our interpretation of the present? That's a pretty deep answer, but
it is.
Generally,
but I like it.
I'd say that 80% was definitely the sweat and the blood that I put into it, but 20% I have to give that up to whatever you want to call that, luck, fate. Put a name on it, label it however you want to, but that's how I'd split it down.
Yeah, I love that. So 80-20 is, I appreciate that answer. It is a deep answer, a thoughtful answer, which is what I'm always happy to hear. That 20% is probably more than what most people will give to the luck or the fate or whatever you want to call it. And I think I've told you before, I'm a fan of Tony Robbins and that kind of thing, and he refers to it as grace. That's like the one thing you need is kind of for things to sort of fall in line or to align. Plenty of people will give a much, much smaller percent. Not to say that one answer is better than the other or right or wrong at all. It's meant to be interpreted totally however you prefer. But to hear from somebody like yourself who's doing so much, to hear that you're willing to give up that much to the universe coming together, that's pretty cool to hear. And Bruce here saying we make our own luck. I definitely believe that too. You can't just sit in a room and things won't just happen for you. You have to get out there and make it happen too. So where can people find you specifically if they wanted to get in touch with you?
So I'm on IG, as you guys know, at dry.i.jedi. My website, our clinic website, is usually a good place people find me at ilabs.ca. Mydryeye.ca is another vehicle to get to me. or ask Carbier. He'll be able to put you in touch. I'm going old school. Call me on the phone. That's what you can do. Okay.
Do you have a pager still? Can they page you?
I actually found my old pager. I found it the other day, cleaning things out. All and I had the old flip phone. You know, like the old Motorola flip phone.
Those
Some
are
of this
cool.
stuff. It's oldies but goodies.
Yeah, the StarTAC, was it? That one's pretty cool back then. Awesome. Once again, Richard, thank you so much for doing this. I definitely appreciate you taking this time. I look up to you and everything you're doing, and learn from you from afar. And I look forward to meeting you in person sometime soon as well. Any last words of wisdom that you'd like to share with the group before we close the call?
Well, first, I'd say thank you for, number one, for this. It's been great. I'm glad that we got a chance to do it properly. And just in general for keeping people engaged. I think however big or small a platform anybody has, I think the minute that you start to put good minds together, you know, great things happen. So thank you for doing all of this. And I think in general is you know, for the younger folks that are out there who are carrying a lot of anxiety under their belt right now, you know, this too shall pass, and there are people around you. We're all going through a similar level of grief here. And I want to call it grief. Don't be fooled that it's anything else. But there are people around you. There's two people right here, and there's a few more, I'm sure, in your community and around you that lean on and ask them and talk about it. The more we talk, the more we'll get through this. And trust me, this is going to be this. I think there's an article today. They referred to this moment as the great pause. I think it's a wonderful description of what we're going through.
Yeah.
So enjoy this great pause, because it's never happened in my lifetime, and maybe it'll never happen again. So enjoy the moment.
That's wonderful. Thank you. Thank you very much. And thank you everybody who joined the call. I appreciate all the comments and the questions. Truly appreciate all the engagement, and everybody stay happy and healthy.